So we've talked about a lot of things related to pain, and including some things that people can buy, prescription drugs and stuff like that. What is your approach to treating it? I mean, you have a book called Holistic Pain Relief. What are some of the things that you have in your toolbox, I guess, to use?
Well, the first thing is food. So the first thing I tell people to do is have half their plate be vegetables.
Sure.
And go for the rainbow colors of the vegetables. Eat all different colors. And those actually are very tough negotiations with patients, and that's I mean, I've had people who come in and they're eating donuts and a cola for breakfast, a cola being something that's that size, and I have to try and convince them that they need to, get vegetables even into their breakfast, and so we talk about that. I do work with supplements as well. So the three that I find are the key for just about everybody are vitamin D, because it's been shown that the North American population, everybody living north of Florida, which is just about everybody, is vitamin D deficient. Chronic pain populations are particularly vitamin D deficient, and that's been shown repeatedly in studies. When you look at people with chronic pain, for whatever reason, whether it's the chicken or the egg, and I'm not sure we totally understand why, because supplementation doesn't totally solve the problem. You can get some people up higher with their vitamin D, but some people's vitamin D won't go up. Absorption through the stomach, maybe, but even if you give it to them under the tongue, sometimes it doesn't go up. So there's still stuff about vitamin D we don't understand. Magnesium. I tell people they need to get magnesium at a good supplement store or health food store, or consult a nutritionist or dietitian about what type of magnesium. Some magnesium is designed just to give you diarrhea and prepare you for a colonoscopy. That's not the kind we want. We want the kind that actually gets into the muscles. Blood tests on magnesium don't tell us if we're deficient, because magnesium is inside cells. So it's inside our muscle cells and inside our nerve cells. And so it's very important not to be guided by a blood test, but to be guided by what's called bowel tolerance. So you take as much magnesium as your body can tolerate without getting diarrhea. And that's how much your body needs on a daily basis. And people will find over time that they need less and less, especially as they start eating a better diet and as they start to replenish their stores. So our bones, our muscles, they act as a reservoir for magnesium in the same way as bones act as a reservoir for calcium. You can have terrible osteoporosis and risk of fracture and still have a very normal calcium test on your blood. Because it keeps coming in from your bones, and your bones are the reservoir. Same thing with magnesium. So magnesium relaxes muscle. It has many functions in terms of clotability of blood and allowing nerves to function properly. So there are many ways in which it can affect pain. And the last of the three, but not the least important, are omega-3 fish oils. They're anti-inflammatory, and they really do help with pain. There are some good studies on all three of those supplements for pain.